Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about the eye testing and spectacle voucher and the universal health voucher. Joining me in studio is Dr. Anand Persaud and Dr. Farrah December. Welcome to the program, Dr. Anand.
Thank you very much for having me.
So today we're talking about the eye testing and spectacles voucher program. And we know that this program has been ongoing since the year 2024. And in 2026, we have exciting news because the program is now extended to all ages. For those persons who are now hearing about the program or now thinking, oh, maybe I should, access this voucher and use it. Tell us a little bit about what this program contains and what problem does it solve?
Yes, thank you very much. Definitely exciting news for the public. So we started in 2024 doing or giving out vouchers for eye testing. That was for the children under 18 years of age,
Yes.
and for the adults who were senior citizens, so above 65. And once you did an eye test at any of the private facilities, we gave you a $15,000 voucher, which helped with paying for your spectacles. That being said, I think two things pushed a lot the expansion of the program. One, we had a great public demand. So across the healthcare facilities, across the service providers, we saw a lot of persons coming out to get tested, get their eyes tested. And then, of course, the ranges between those two previous ranges, we had working adults and so on. They also said, hey, we want to be included too. And so we thought it was important to also include this group and to have them get their eyes tested and get spectacles if required. But beyond that too, behind the public demand, the public health aspect is very important, whereas we saw in the results that we were getting a number of persons, whether they be children and senior citizens, that had several ailments of the eye. So we saw a lot of persons with short-sightedness, farsightedness. In some of the senior citizens, we saw a lot with cataracts. So we thought in order to make the population more productive, more efficient, and ensure that we cover all age groups, we're going to expand the program and ensure that everyone is able to access these important resources for eye health, because it determines your livelihood, it determines your education, and it determines your personal advancement.
What financial barriers is this program able to reduce and thereby, have equality in terms of persons across the country?
Yeah, so I think importantly, I think a lot of persons might have said, oh, well, it doesn't cover the entire cost for glasses, but that of course is not the intention. In many cases, we have worked with our service providers to bring their rates to an affordable rate. Whereas you no longer have to pay for an eye test. You take a $2,000 voucher, you get your eye test done. And if you need glasses, that's $15,000 added to the value of paying for your glasses. So you might have to pay a small sum, but it helps a lot and it goes a far way. In some cases, we've seen with some service providers, they're able to do special programs where they bring the cost of the spectacles, even in some cases, close to $15,000.
Wow.
So it helps a lot, most definitely.
Very beneficial. I know a lot of persons may have eye issues and they would take their time or hesitate a little bit to go get their eyes checked because they know it's a whole lot of money we're going to have to spend. But this program actually does well for all Guyanese. How does the voucher program works in practical terms? From the time a patient collects that voucher, what happens next and what should they do after that?
Definitely. So the process is relatively straightforward in how it's supposed to function. When a person goes to a healthcare facility or they come to the Ministry of Health, they uplift a voucher. In some cases, we do outreaches or we go to them, whether it's at a company or it's a private institution or a club, we share out the vouchers. So you get your $2,000 eye test voucher. You take that to a service provider. There's a list of service providers at the back of the voucher. Once you go there, they test your eyes. Once they give you a prescription saying that you have an ailment and you require spectacles, you return that to your health center or to the ministry and you uplift your $15,000 voucher. You submit that to the service provider. And that's the end of the process in using the voucher. So relatively streamlined.
Relatively. Thank you so much, Dr. Anand. We're going to go into a short break and be right back with more on the eye testing and spectacle voucher.
Healthcare coverage is now easier and more accessible with the Ministry of Health's voucher program. This initiative offers preventative care to help detect diseases like diabetes, prostate cancer, kidney disease, and cervical cancer before they advance and pose serious life-threatening risks. It improves the quality of life for all Guyanese at a subsidized cost. The best part? All Guyanese are eligible. Vouchers are available for general health checks, cervical cancer screening, and eye testing and spectacles. So what are you waiting for? Visit any health center in your region to get your voucher because you deserve access to essential health care.
Okay, good. Oh, all of that? Oh, all right. Yes, I'll let William check. All right. William, your Aunt Maria said that the government have some new health voucher that you could go and do your blood test at those private hospitals. Check Ministry of Health Facebook or TikTok page and see if they have anything posted.
The government of Guyana, through the Ministry of Health, is committed to improving the health and well-being of all citizens.
Look, Dad, it's true. They got for children too.
Oh, let me see.
As part of this initiative, a range of health vouchers is now available to every Guyanese.
Marcos!
Mama, what is it, Maureen? We're making all the nice for, man.
Oh, you're right there. Marcos, I went to collect these $10,000 vouchers for all of us. Look, it says here that you could test kidneys and blood count and even a thyroid function test. I find you need to go and get your diabetes check as well because you be pee-peeing a lot these days.
Mama, Maureen, please. And the word is thyroid, not thyroid.
Oh, thyroid, same thing. Look, William.
We was just checking it online.
William, it says here scan to see list of providers or something. I don't know what I mean. Do your thing.
These vouchers cover essential health services, including eye testing and prescription spectacles, cervical cancer screening, and the universal voucher, which includes a comprehensive set of blood tests.
Look, you got plenty of places. Look, this one even close by, you know.
Oh,
Yeah.
Marcos, that settles it. Bright and early tomorrow morning, we are going.
Bright and early, Noreen. Huh? Like you acting like if your kidney's falling out and we got to get it checked.
Marcos, you know you don't take our health seriously at all. Look, William had to get glasses the other day and you didn't want to take him. If it wasn't for me and well, the ministry eye test voucher that they give out, my child could have gone blind.
All right, Noreen. We're gonna go and do the test, man. But what if the test costs more?
Marcus, seriously? So we can't pay the little extra? Look, Marcus. These tests cost like $2,000 and $3,000. How much more could it possibly be, Marcus? $2,000, $3,000 is only in this country you could get these things?
All right, Noreen, fine. And you will be using your cervical cancer screening voucher too.
Oh, Marcus, you don't need to tell me all of that because let me let you know your girl Noreen intends to look fit and proper this year.
We encourage everyone to visit your nearest health center to learn more about these vouchers, including eligibility and how to access the services. Vouchers can be used at approved private health facilities across the country, giving you the flexibility to choose where to receive care. Take advantage of this opportunity. Early screening can lead to early treatment and save lives. Prioritize your health today for a longer, healthier tomorrow.
Welcome back to the program. For those of you who've just tuned in, today we're talking about the eye testing and spectacles voucher. And with me in studio is Dr. Anand. Doc, could we talk a little bit about the importance of good vision health and the reason why our seniors, our children, and our general population should get screened and take advantage of this opportunity at this time?
Yes, thank you very much. That's a very important question. And I'd like to simplify it and come out a little bit out of the medical terminologies and medical terms. Just to say this, our vision is an important aspect and determinant for our livelihood.
Yes.
Whether you're a child, whether you're a senior citizen, a working adult, your vision plays a vital role. And I've mentioned before, it enables you to have a good education. It enables you to advance your studies once you've left maybe secondary school. You can go into university and make use of the opportunities that are currently available. It helps you in your work, the daily work that you do, whether it's the work that you do on the road, whether it's labor work, whether it's in the office, it doesn't matter. So the importance behind getting your eyes tested and persons might put it aside a little bit on the back burner. But you can just imagine if one day you had an ailment with your eye, you become so worried,
Yeah.
immediately you would go to the hospital. So what we're trying to do is to prevent that. We're saying the government is providing the resources for you to go and test your eyes before. That's why it's called a screening.
Yeah.
You're screening before the ailment even occurs. Or if there's already an ailment, we're able to detect the early signs of it and have the necessary treatment available for you. So that's the intention and the objective behind the program. And then, of course, comes the ability to access spectacles and be able to use it on a daily basis if required. But it also helps preventing complications which can develop
Yes,
if you
in the
do not
future.
have spectacles or use them correctly.
Indeed. What are some of the most common but overlooked eye conditions that early testing can prevent and detect?
So definitely, I'll go back a little bit in my own experience in school. So I recall when I was in primary school, one time my teacher called my mom and said, he's sitting at the back of the class, he's not really paying much attention, or he started to do not so well compared to before. And it came to the point where they took me to the optician, then realized that I had short-sightedness. And so I was unable to see on the board, and so I was not
Yeah.
performing as well as I should. And so therein lies one of the important aspects about having eyes tested, especially in children. You don't necessarily think that a child might have an eye issue or might have a refractive error until you get to the optician and do the tests. So I think importantly for parents, utilize the opportunity, let your kids get their eyes tested. You might be able to identify refractive errors or issues that can be fixed from the early onset versus waiting until it's later on when you might need to use glasses permanently. And for adults also importantly, sometimes you think, someone is a little bit advanced in age, it's normal that they wouldn't see too well. In some cases, yes, but there are other complications like cataracts and other
Yes.
ailments related to chronic diseases that can affect the eye or the retina specifically. And so by doing this constant check or utilizing the voucher each year as a resource that's available, you're able to identify complications that can be prevented even in senior citizens, and the same applies to the working age population.
Indeed. I believe that with the government extending, this voucher program to all ages, it now becomes an activity or a thing that families can do together. They can go out and get their eye tested together. So this is something great that they can look forward to. In terms of documentation and requirements, what does the public need to know about when they're going to utilize the service or to actually get that voucher? What do they need to work with?
Yes, so definitely. For the purposes of accountability, we're just asking that when adults go to uplift the voucher, they take a form of identification. So it can be an ID card, it can be a passport or a driver's license. And if you are collecting vouchers on behalf of minors less than 18 years, you can also take your ID, your passport, or your driver's license, and you sign on behalf of those persons.
And these vouchers can be uplifted in all regions, at health centers in all regions.
Yes, so the vouchers are available at all the healthcare facilities across the country, specifically your health centers, which is much more closer to your location. And we also have some other designated sites over the next few months that we're going to identify.
Okay, before we wrap up this aspect of the program, Dr. Anand, what would be your encouragement to our listening and viewing audience with regards to accessing this service? I know we would have reduced the cost, and reduced that burden. And so we want persons to be able to access the service. We know Guyanese, we have a culture whereby we wait until things, would have developed and in its worst stages before we visit our health center. But we want to reverse that. We want to unlearn that. What would be your encouragement to them?
So I think maybe two things I'll identify. If you think about it, realistically speaking, there aren't many places or countries in the world where you can go and access services through the public health system to get your eyes tested for free, basically, or have subsidies for spectacles, even in developed countries. That is I wouldn't say a luxury, but it's a resource that's available to Guyanese that goes a far way, because of what I mentioned about the importance of eye health. Now, the second point that I wanted to mention goes back to what I had said earlier about the importance of getting your eyes screened. You don't necessarily think it's important until something develops and impedes your vision.
True.
Then you panic. So in order to prevent that from happening, we're encouraging, you want to go out as a family, if you want to go out, a mom, a single mom and the kids, or kids together at the schools, whatever it may be. We're encouraging persons to make use of the opportunity. Go and get your eye screened as early as possible because your eyes play a vital role in your future development.
Indeed. Thank you so much for joining me on the program, Dr. Anand.
Thank you very much for having me.
The eye testing and spectacle vouchers are back and better than ever. The Ministry of Health is proud to announce the continuation of the eye testing and spectacle voucher program, and this time it's open to all ages. That's right, whether you're a child in school, a working professional, or a senior citizen, you can now access and benefit from support toward getting the spectacles you need. Clear vision is essential for learning, productivity, safety, and overall quality of life. This initiative ensures that no one is left behind when it comes to eye health. Visit your nearest health center to uplift your voucher today. Take advantage of this opportunity, protect your sight, and improve your vision.
This message is brought to you by the Ministry of Health Central Georgetown team. Health is wealth. Use the voucher, take care of yourself. It is free, you don't have to buy. Hurry up and don't mama guy. Won't tell you no lie. If you need glasses, we got it. 15 grand safe in your pocket. Test your eye, make sure you can see. We even got voucher for HPV. So check your liver, your thyroid and your kidney, your prostate and HbA1c. Universal voucher for everybody. Distribution throughout the whole country. The Universal Health Voucher is being distributed by the Ministry of Health at all clinics and health centers nationwide. This message is sponsored by the Ministry of Health Central Georgetown. Health is wealth. Oh yeah.
Welcome to the program. For those of you who have just tuned in, we're now talking about the Universal Health Voucher. And joining me on this half of the program is Dr. Farrah December. Dr. December, tell us a little bit about this Universal Health Voucher. We know that the government of Guyana would have decided to continue the voucher program for this year, 2026. So tell us about it and what it offers to the Guyanese people.
So thank you for having me. So our Universal Health Voucher now allows us to be able to do some blood tests, some screening blood tests, which will be able to tell us what is happening with our bodies even before we start showing symptoms. And that's the reason why we're so excited about this voucher program, because it allows you to now take your health into your own hands. Now, the Universal Voucher is available for adults 18 years and older. And we do have Universal Health Voucher for our children from newborns all the way up to 17 years old. So some of the tests that we have available with this voucher, you can do a urine analysis, which tells you what is happening with your kidneys. It can tell you if your body is excreting what it needs to excrete at the right times. And we have other tests such as your hemoglobin, and we also know this as your blood count. We check various things like your liver functions and your kidney functions. And of course, we know these are vital organs. So generally, we know that adults usually come to the doctor after they've started showing symptoms. They usually bring the children after they've started showing symptoms. And we find that this may be a really good way for you to know what is going on with your body even before symptoms begin to show.
Indeed. And this Universal Health Voucher is really a great initiative because it allows persons to be able to, have those health checks that are necessary. And it's at a subsidized cost too, because it's a $10,000 voucher. That's the first thing. So you don't have to worry about, I gotta go pay to do this test. You can utilize any of the tests there using that voucher. For persons who are wondering, how can I pick up this voucher? Where can they uplift those vouchers within their regions?
So vouchers are available at any one of our health centers, and you can also uplift vouchers right here at the Ministry of Health, which is located in Brickdam. So don't be afraid. Go to your nearest health facility, your nearest health center. Please, you must walk with a form of identification to be able to uplift your health vouchers. And parents, you can uplift your vouchers for your children as well. But the adult who's uplifting must have a valid form of ID.
Indeed. How important is initiatives like this in encouraging persons to take the preventative measures they need to take in order to reduce, various health concerns?
So, we find that we keep telling people, you need to be healthy and so on. But day to day life gets to everybody, and we get busy, we get so bogged down with everything that we're doing. So by getting this voucher, all you have to do is go to any one of the laboratories. So at the back of the voucher, there's a QR code. You can scan the QR code. It will show you all the labs that are accepting the voucher. So you can just take this and you can get your test done. When you receive your test results, you can take it to the doctor at your local health center or your family doctor for them to read and make sure that it's okay. The other thing too, because we know that this isn't something that we've started now. Last year, we also had the health voucher. So for those who would have done last year, can collect this year. And you can compare to be able to see what was happening with your body last year, what's happening this year. So this is how you were able to pick up on little things that may be happening very slowly. So it really is a good initiative.
Indeed, it is. For parents and children, I know you work a lot in the school health department. Tell us a little bit about what parents need to know with regards to their children utilizing this universal health voucher. I know that you guys would usually visit the schools and you all would do the screening and all these things. What do parents need to know? Is there a consent form that they need to sign to ensure that their child is able to get the screening done?
So when our school health team goes into the schools to do our school health screenings, from time to time, we may have this service available.
Yes.
Now, I'll just speak about the secondary schools because these children are a lot older. These children can sign the consent form, have their parents sign it, they can return it to the school, and by the parents giving consent, we're able to take off the blood sample. Or if the parents wish, they can just get their vouchers and they can then go with their child themselves. But remember, the school health program allows for us to bring the health services to the child while they're at school. So busy parents who may not be able to even have the finances right now to take your child to a health facility, take advantage of when the school health program comes into the school and you can have all of these being done for your child right there at school.
Indeed. Before we wrap up today's program, we've spoken about the eye testing and spectacles voucher and now the universal health voucher. Dr. December, do you have any final words of encouragement to our listening and viewing audience, especially our parents and guardians?
Yes, so I'm very passionate about children.
Yes.
So I really want to encourage parents, take advantage, especially of the school health program, take advantage of these vouchers. We want to have healthy children because our healthy children will become healthy adults. And as long as we have healthy adults, we have a healthy nation. So parents, guardians, children, please get your vouchers, get your test done, and let us be healthy.
Indeed. Thank you so much for joining me in the program today. And I want to encourage you to keep up the good work that you have been doing here at the Ministry of Health. Thank you for joining me in the program today. I'm Alicia Martin, reminding you to uplift all of your health vouchers at your local health centers or the Ministry of Health at Brickdam. Thank you again. Goodbye for now.